Hi everyone. In this video we are going to talk about residual cyst. A residual cyst is a cyst that develops after incomplete removal of epithelium associated with a previous cyst. The most common sources of this epithelium include an inflammatory cyst and a dentigerous cyst. A residual cyst is usually asymptomatic and is often identified in a radiologic examination of an edentulous area. If not identified, the cyst can enlarge, resulting in a painless swelling of the jaw. If it is secondarily infected, a residual cyst may be identified by the pain it elicits. Residual cysts can occur in both jaws, although they are found slightly more often in the mandible than the maxilla. The epicenter of a residual cyst is located in the former periapical region of the involved or missing tooth and in the mandible. It is always superior to the inferior alveolar canal. In this picture, the epicenter of this residual cyst is located superior to the inferior alveolar canal. It has displaced the canal in an inferior direction. Note that the cortical boundary is not continuous around the entire cyst. A residual cyst has a well-defined and corticated border unless it has become secondarily infected. The internal aspect of a residual cyst typically is radiolucent, although dystrophic calcifications may be present in long-standing cysts. Residual cysts may cause expansion of an adjacent bone surface and thinning of the overlying cortex. In the maxilla, a residual cyst may displace the floor of the maxillary sinus or course of the inferior alveolar canal. Residual cysts can displace teeth or resorb tooth roots. Without a patient history and/or previous images, clinicians may have difficulty determining whether a solitary cyst in the jaws is a residual cyst. Other examples of common solitary cysts include OKCs. A residual cyst has, however, greater potential for expansion of bone than an OKC. The staph defect is located more inferiorly in the mandible, away from the tooth-bearing areas of the jaws, and the cortex of the staph defect is usually very thick. The treatment of residual cysts is surgical removal, marsupialization, or both if the cyst is large. Thank you very much for watching. If you liked it, please like and subscribe. Goodbye.